You're week one into your intern year and you've been doing well and you're so excited to be able to work your first night shift. Your night shift is about an 18-hour call and you're currently on your inpatient internal medicine rotation and you are stoked. It's hour 10 and the night's been very quiet. You haven't had a lot of pages. So you are hungry, so you get ready to go down to the cafeteria to get some food. On your way down to the cafeteria, you get a page from the nurse. The page says that the nurse is very concerned about a patient who's having shortness of breath. You remember that this patient is an 83-year-old gentleman who was admitted for a COPD exacerbation. So you turn around and you go and assess the patient. You go into the patient's room, you look at his vitals are all within normal limits. You look at the patient, he's not in any acute respiratory distress. So you start your physical exam. You listen to his lungs, you listen to his heart, you don't hear any crackles or wheezing. Heart exam doesn't have any murmurs. So you are not too concerned. You continue your physical exam, and then you take a peek back at the monitor, and you see that his respiratory rate is starting to increase. He's starting to become more and more tachypnic. And then you also see his O2 status dropping. He is 88%, and now he is going down to 85, 84, and now you're getting very concerned because you see that he's also having moderate respiratory distress. He's using his accessory muscles for breathing, and now he can only get about 2 words in before he has to take a deep breath before he could get several sentences in. The nurse is also very extremely concerned. The family's at bedside. He has a young daughter who is crying as well. The nurse looks to you and says, Doctor, what are you going to do? Your heart rate starts to go up. You start to sweat. Your pager still keeps going off because you're taking care of 24 other patients in the inpatient service. You remember back from medical school that if he continues to have increasing respiratory rates and if he continues to have decreasing O2 saturations, he's going to need to be intubated and he's going to need to go to the ICU. So in that moment, what are you going to do to make sure this patient doesn't continue to further crash? What are you going to do? On my YouTube channel, I will be discussing these case scenarios in detail and provide you with the framework that you could use for these situations. My goal for this channel is to help you transform from being a medical student into a medical doctor. So subscribe to my channel and keep up to date with new content. And I'll be seeing you on the wards.